I'm Zaid Shalchi, and today we're going to be talking about central serous retinopathy. So, central serous retinopathy, or CSR, is a disease affecting the retina, which is the light-sensitive tissue in the back of the eye. Fluid pools between the retina and the underlying support layers in CSR. With time, this fluid causes damage to the very fine cells of the retina, and this can lead to blurred vision. In the majority of cases, this fluid absorbs spontaneously and the vision improves again. In some cases, however, the fluid can recur or affect the other eye. So patients with CSR typically say that they notice the sudden onset of a central blurred patch in one eye. This can sometimes be improved with a change in glasses prescription. The symptoms resolve within 6 months in 90% of people. In some cases, the symptoms can recur or persist for longer than 6 months, sometimes affecting central vision significantly. So central serous retinopathy is a poorly understood condition, but we do know that it is 9 times more common in males than females. It typically affects males between the ages of 30 and 60, but of course there are exceptions to this. It is more common in those taking steroid medication, such as for asthma or eczema. Patients who have increased steroid levels due to a pituitary or adrenal gland disease get CSR more often, as do pregnant women. Some have suggested that a type A personality is a risk factor for CSR, but the evidence for this is very variable. So how many types of CSR are there? Well, classically it is divided into acute disease where the fluid absorbs within 6 months, or chronic disease where the fluid persists for longer. Many patients naturally ask about treatment, and really the primary treatment for CSR is to stop any steroid medication if this is being taken. This will need to be done in conjunction with the doctor who has prescribed the steroid medication in the first place to ensure that it can safely be changed. As we've said, 90% of CSR cases resolve within 6 months, so conservative management is advised. In patients with chronic CSR, treatment in the form of laser photocoagulation, sometimes called hot laser, or photodynamic therapy, sometimes named cold laser, can be very effective.